In this video, you're going to find out all about a brand new medication called Sublocade. Now, Sublocade is the newest advancement in medication-assisted treatment. And here to tell us all about it is Marc Burrows. Now, not only is Marc an MET specialist, but he also does a lot of volunteer work on the side, running needle exchange programs, and also is a licensed distributor of naloxone, the over-the-counter medication that can save lives in an overdose. If you haven't seen my video on that, make sure you check that out. But Marc's here to tell us all about Sublocade. It's a once-a-month injection that shows a lot of promise for helping people taper off of heroin and pain pills and any other kind of opiate. So traditionally with medication-assisted treatment, we're talking about opioid use, right? And so the medicines, first it was methadone, right, and then Suboxone came along. Yeah. And now there's this new thing out there that you were telling me about the other day, brand new thing called Sublocade.
Right. Right.
So can you tell us what Sublocade is, first of all?
Yeah, so Sublocade is a monthly buprenorphine injection.
Okay.
So buprenorphine is the same drug in Suboxone.
And buprenorphine, am I understanding it right, Marc? It's a long-lasting opiate.
Yeah, it's a long-acting opioid. It's a partial agonist, so
what does that mean in regular people terms?
Yeah,
that sounds fancy, Marc. Tell us what that means.
So a full agonist would be something like morphine or heroin, and it produces euphoria with that. Hence, people taking it to get high. You can overdose off something like that. Whereas buprenorphine, being a partial agonist, it produces a ceiling effect. So after a certain amount of it, you don't really get an increased effect from it. It's very difficult to overdose off buprenorphine.
Okay. So it's like safer.
I guess you would say it's a safer opioid. That's a way to put it.
Alternative. Okay.
It also blocks the effects of other opioids.
Okay.
So, and the reason it does that is because it has such a strong affinity or a strong grip to the opioid receptors in the brain that when someone's on buprenorphine, it prevents other opioids from latching onto those receptors.
Okay.
And which is a good thing for treatment, obviously.
Right, because it helps prevent overdose. It helps prevent people trying to use on top of their medicine.
Yeah.
Okay.
So it prevents opioid cravings. It kind of, you'll hear most people on MAT say they just feel normal. They don't really feel high. They might just kind of feel good, and most of them will just say they feel normal on their Suboxone.
Gotcha.
Yeah.
And Suboxone historically, so far up until this new medicine came along, you give it to people either in like a pill form or in these like dissolvable strips that are kind of like Listerine strips.
Right.
And they take it somewhere between 1 and 3 times a day or 1 and 4 times a day. Is that right?
Yeah. Usually once or twice a day, sometimes more.
Okay.
But yeah, it's called a sublingual tablet or a film. Suboxone comes in a film. Other forms come in a tablet, and it just goes under the tongue and it dissolves.
And so now they have this new thing out. This is the Sublocade that's just been out like a couple of months. I guess is when I heard of it. Okay.
Yeah.
And so tell us how that differs from the normal way of taking Suboxone.
Yeah, so it's a subcutaneous injection, which means it just goes kind of under the skin around the abdomen, so around the belly button. Okay.
And so it's an injection that you get once a month.
About once every 30 days, yeah.
Okay. And so what would be the benefits of doing a once a month injection versus the strips, the sublingual strips?
One of the big ones that I like is it's one and done. So the person comes in, they get their injection, and they're good for the next month. So they don't have to think about that medication anymore. It kind of makes the medication part a non-issue.
Right.
They don't have to wake up in the morning and take it. They don't have to remember to bring it to work with them. They don't have to worry about keeping it hidden from certain people or children. So it takes like all the problems that could arise from just possessing it, takes those problems away. It also gets them out of that routine of habitually taking something every day.
Mm-hmm.
And I think obviously with addiction, that's a big problem. So
it's the whole, almost like the whole people, places, and things. It's the change in the routines and the neural pathways. And I tell people to wear different clothes and take a different route home and like change everything possible. So getting out of that, like taking something, ingesting your medication really is kind of helpful.
Yeah, and I think when we look into like the behavioral aspects of substance use and addiction, and we talk about, learning new coping skills, and we look into why did that person use those drugs in the first place, it takes the act of taking a drug or a substance, taking it just to change the way they feel. Mm-hmm. So if I had a bad day at work or an argument or whatever, and I just want to change the way I feel, taking something orally like Suboxone or anything else could kind of keep that cycle going in some ways. So Sublocade, a monthly injection, eliminates that.
It kind of reminds me of with alcoholics. Sometimes we have a thing called a Sober Link, which basically is this really like high-tech alcohol monitoring device. Okay. And when I'm talking to patients about being on it, we love this thing. We found it's like really effective, but I tell them it's going to make it so much easier because once you decide to get on this thing, you're not really going to get around it. It's pretty high-tech, and you don't have to re-decide 1,000 times a day to be sober. Mm-hmm. And it makes it so much easier because you don't have to be obsessed with it. You don't have to think, okay, my wife's not going to be home for 4 hours. Maybe if I just have a couple drinks, it'll be gone. You don't have to do math. You don't have to fight sneaky thoughts. And so it literally makes it easier. And I think a little bit of that's what I'm hearing in what you're saying, Mark. It's like, even if they're on the Suboxone, they have the strips. They can still have I'm not going to take these. Maybe I'm just going to sell these and I'm going to take something else. Or maybe I'm going to save them up and take them all at once. There's all those sneaky, addictive thoughts that there's still room for when you're taking it the other way.
Yeah, and I think if you take all of that out of the equation, I would think that it allows for like a much better quality of recovery. And another thing is, a lot of times if someone's on Suboxone and they're trying to taper their dose, right, and they're trying to get down to a lower dose to eventually come off of it, well, that's a really hard process, and that takes month after month of kind of whittling away at that dose. So there can be a lot of up and downs created in that. And if someone's trying to take less, but again, then they have those emotional triggers or stressors, it's real easy to say, well, I'll just try again tomorrow. I'm gonna take the bigger dose. If I'm taking 2 strips a day and I'm trying to take 1.5 a day, but I have an emotional stressor, it's easy to say, I'll just take that extra half a strip like I normally would have. It's like relies a little too heavily on the willpower thing. It's like I was like, you can feel really solid right now, but eventually you're going to be worn out and tired and have a bad day, and the gas in the gas tank is going to be low. And that willpower thing, early on, I'm like, you can't rely on that. You got to have something else. Right. And so would you say it's a bigger commitment, recovery-wise, to get on Sublocade versus Suboxone? Yes, I would think it's a bigger commitment for someone to say that they're ready for Sublocade. So it's kind of like a bigger step or a more serious step, something that it just it gives you less wiggle room when you make that decision. It's more of a commitment. Okay. Yeah. And you were telling me something interesting. We talked about this the other day. You were saying that
there's been some evidence, early evidence, that it's easier for people to eventually come off of the Sublocade versus coming off of the Suboxone. Can you tell us about that?
Yeah. So there aren't any studies on this yet, but there have been some reports of people saying that after about 6 or 7 months of Sublocade injections, they just didn't go back for that next injection, and that their body at that point is so saturated with the drug that it just slowly and naturally tapers out of the system, out of the body.
Is it kind of like an antidepressant that builds up in your system? Is that what you're saying, Mark? And then it takes a while, it kind of just slowly, even when you stop taking it, it's still slowly coming off?
That it just kind of slowly tapers out over the next couple weeks. Mm-hmm. And so the reports that have been made have said that up to 12 months later, they still never felt withdrawal symptoms. So that's big news. That's really exciting if that's true.
Yeah, if that's true, that's pretty huge, because what my clients have always told me about Suboxone is that they always say I've never really seen people have much trouble going down until they get that they'll just be on the tiniest little piece. Yeah. But going off those like 2 milligrams or freaking 1 milligram is like so hard. That's where they hit the wall. Mm-hmm. That's my experience with what clients tell me.
Yeah. It's a difficult process, and it takes a long time, and a lot of things need to be lined up for someone to be successful in that. And God, if this just kind of tapered out on its own without the person even having to control any of that, that's a big deal.
That would be huge. You're right.
Like you said, like it takes the will. I think however you said, it takes the willpower out of it, and it takes like the discipline and all of those things of controlling that substance perfectly every day to taper.
Because you can have willpower 95% of the time and be doing awesome, but that one little moment where you just hit the wall can mess it all up. Yeah. Okay.
So I'm really excited about that. I haven't had anyone get to that point yet. I have some people who are hoping to do that.
But it's so new though. You haven't even
right. It's been 7 months or something.
Are there any cons to going this way? What would be a drawback of choosing Sublocade?
Well, of course, it can be expensive.
You got to shoot it to a straight now.
So you got
So it could possibly be more than Vivitrol. Like, how much are we talking about?
I think it's about the same as Vivitrol, actually. So, I believe the cost is like $1,500 a month per injection. Now, there's copay assistance, so that cost might get down to $700 or $800 a month with copay assistance. So right now, obviously, that's a lot of money. Mm-hmm. Right now, it's been mostly for people with commercial insurance, or any insurance for that matter. Mm-hmm. So all of our people that are on it are all insured, and none of them have paid a dime for the medication. So insurance is covering it 100%. Really? Yeah.
So if you have private insurance and it will cover it, this might be a really good option.
Yeah.
Okay.
Yeah, so far so good. No one's been denied. No one's had to pay anything. They have the companies come out with this great copay assistance to help with that. So yeah, that's big, because even for some oral medications, patients might pay out of pocket for it.
Oh yeah, just the regular can be really expensive.
Mm-hmm. Yeah.
Okay, so if you don't have private insurance or insurance at all, you could end up paying as much as $1,500 a month. If you do have insurance, you might not pay at all.
Yeah.
Okay. And then there's anywhere in between, I'm guessing.
Yeah. And like I said, I think even if you don't have insurance, I could be wrong about this, but I think even though the cost of the drug is $1,500, the company offers some sort of copay assistance even to people without insurance to get the cost down to around $700 or $800. Okay. I could be wrong about that, but I think that's how it works.
I do want to say this because a a lot of families view our videos. So there's a lot of parents and spouses going to be watching this video. And they're thinking, $800? Holy crap.
Yeah.
I just want to make a side note to the family members. If your loved one is addicted to pain pills, they are very likely spending more than $100 a day.
Oh, yeah. Easily. Yeah.
Easily more than $100 a day.
Yeah.
Feeding their habit.
Very easily. Yeah, $100 a day is probably average, you know.
So $800 is like 8 days worth for a month. So when you think
Right.
about it, it's hard sometimes for family, but you've got to put it in perspective sometimes. All right. Is there anything I didn't ask you that I probably should ask you that people might want to know?
I think one fact that maybe, especially for family members, is the elimination of people being able to divert Sublocade.
Okay, so divert is fancy for what,
So
Mark?
diversion is like when we hear about people abusing it or selling it on the streets, or getting it for some improper reason. So sometimes you'll hear about people getting Suboxone and then trading it or selling it for what they really want,
Right?
like their heroin or whatever. So the way Sublocade works is it's highly controlled, so it never gets in the patient's hands. So it goes from the specialty pharmacies right to the doctor's office. The doctor's office takes it and they lock it inside a little box, and that gets locked inside a refrigerator. So it's double locked. So it's never in the patient's hands, which I think is huge.
What are your people that you have so far? Are you getting any feedback about it? Just personal experience. What are people saying?
So far, we haven't had any complaints. Everybody seems to love it. I think the biggest pro that people like, the biggest benefit that people say, is they wake up and they feel normal. Sometimes if people, especially are dosing only once a day, by the time they wake up the next morning, they feel kind of crummy,
They're in
kind
withdrawal.
of fatigued, right? They feel kind of withdrawalish, just
I could see
not
that, yeah.
great,
So they feel level.
They just feel more level.
Okay,
Yeah.
that's huge too.
People say they just wake up and they feel good, and they don't. There's not that hour of waiting to take their medicine and letting it kick in and all that. The whole idea of the medication, just a non-issue. It just takes it out of their lives.
For tons more information on all things addiction and recovery and lots of free expert advice, make sure and subscribe and hit the bell so you don't miss a thing.